Hi, hello, live here. Jonathan Stiano. Going to go through some questions, 7 o'clock on the dot, and in better surroundings, some comments from the last one that I did. Yes, I was in my car. Yes, I was in Sainsbury's car park. So timed it a bit better this time. I didn't do this yesterday, so I'm sorry that I told some people I would do it yesterday, but trick-or-treating got a better of me and had to do the duty in that respect, and so I don't think it would have been a good thing to do it yesterday. So I don't think I told too many people, so I hope I haven't upset too many people. But anyway, here today, I'm going to try and do this regularly. Usually on a Monday, Tuesday is good for me, but as you can see, it varies due to my schedule with Sainsbury's stroke trick-or-treating activities. Okay, so we've got I've got some questions here. If anyone's got any questions that they want to post on the timeline, or but then feel free and I'll answer them. Beth lives a few hours away, and so can't come to the clinic, and has seen another surgeon. Don't say where you're from, Beth, but she wants some non-biased advice from me about breast implants, which I'm very happy to give, because obviously I've got no interest in this, because I don't know you, Beth, but you're having a breast implants with a lollipop lift, and you tell me that your surgeon has offered you Natrelle implants and has also mentioned polyurethane implants, but your surgeon has said that they're not keen on the polyurethane implants unless you've had capsular contracture previously, because the surgeon has said that they do not drop into the pocket, which is an important part of the surgery and makes it very difficult. So I think it sounds like your surgeon's going towards your Natrelle implants, but you are worried. You trust your surgeon, but you're worried about capsular contracture, so you want an opinion on that. Really good question, and my advice on that, you've obviously done your research. I think I like polyurethane implants, and I think they are good, and I do talk to patients about them, but it's like anything, there are good and bad about polyurethane implants, and it's very true that they are difficult to use. So there are some technical issues with regards to using them. They are certainly more difficult to use than silicone implants. I used to only use them in people who have had capsular contracture in the past, and there are still a lot of surgeons in this country will only use them in those circumstances. More and more surgeons are using them for people for first time, and I use them quite a lot for people first time, simply because I don't want to have problems in the future. I do think it's important, though. I always say to people that the surgeon's more important than, or the most important decision, and it's more important than the implants in some ways. So I think if your surgeon's not keen on using, or not, is a bit wary about using them, I would sort of go with what your surgeon's saying to you. And if your surgeon's got some good results and got happy patients, and usually uses Natrelle implants. Natrelle are very good implants, very well respected. Allergan is the manufacturer. They're a very big company, and I don't know if it was you or someone else who said that their surgeon has said that they don't get a problem with capsular contracture. I hear that a lot. A lot of surgeons saying, I don't get a problem with capsular contracture, I'm happy using silicone implants. The problem with that argument is that capsular contracture takes many years to develop. And so you only know if you've got a capsular contracture 5 or 10 years down the line. So a surgeon who's been practicing for 5, 6, 7 years may not see hardly any capsular contracture, and even in 8, 9, 10 years they'll only be seeing the capsular contracture of the cases that they did 8, 9 or 10 years ago, which probably weren't as much as they're doing now. So they're only going to see the capsular contractures of the cases now in 5 to 10 years time. So there's that lag period. So I think a lot of surgeons think they don't see their own capsular contracture, only see other people's capsular contractures, and I think that's because they haven't taken into account that they're only seeing their cases which they did 5 or 10 years ago, which might not be many cases. Does that make sense? Anyway, I think polyurethane are good. I like them. If your surgeon's worried about using polyurethane or is steering you away from them, listen to your surgeon, but at the same time, it's your body, it's your choice, and if you've done the research, you think polyurethane are good, say you want polyurethane. I think polyurethane. I mean, your surgeon's obviously offering them. Hope that's helped. Hope that's unbiased. Been a bit on the fence really, but that's what I'd say. And as with ever, and I say this to patients who see me, if you're not sure about what your surgeon said, go and see another surgeon. Get another opinion. I think we're all comfortable with that, seeing other opinions. If there are other surgeons around, look for a plastic surgeon, fully trained. Back brace BARPs websites have got lists by region, so you should be able to find one in your area. Look for FRCS Plast after their name, that sort of thing. All the stuff that's in my book. It's in my book. Comes up backwards, but yeah. Okay. So Sadie's a patient of mine. Hi, Sadie. She's gone to America. I hope you're enjoying things in America. Had surgery a year ago, nearly a year ago, and just discovered that you are pregnant. Are there any symptoms or issues? So you had a breast implants and had now discovered that you're pregnant, and are there any symptoms or issues? No problem at all with implants and pregnancy. There is no problem with breastfeeding, assuming you can breastfeed. Some people can't breastfeed anyway, so if you can breastfeed, you will still be able to breastfeed with implants in. So implants will have no effect on your ability to breastfeed. Certainly the way I do it, because I pretty much always use an inframammary incision. So I put an incision in the fold, lift the breast up, so I'm not actually cutting through any breast tissue. So there'll be no problems with breastfeeding. No symptoms. I hope they won't cause you any problems at all. I think there is a... Oh, God, now... I should have checked this before I did this. I think there is a paper somewhere suggesting that maybe capsular contracture, pregnancy might be a risk factor for capsular contracture. It doesn't matter, you're pregnant anyway, so what are you going to do about it? But I've got a feeling that there might be an increased risk of capsular contracture in patients who've had implants and then got pregnant. But I wish I hadn't said that. Don't worry about it, because there's nothing you can do about it. But and I don't think it's a main risk factor. I think it's just a paper that I saw once. The only one thing I would say about pregnancy, if someone sees me before they've had breast implants and no, that's not the next question. If someone sees me before they've had implants and I think you're getting pregnant, I'd actually advise you to finish your family first, because getting pregnant and having children can affect the size and the shape of your breasts. So that is an issue. Having surgery, whether it be a breast lift or breast implants or a tummy tuck, whatever it is, anything to change the shape of your body doesn't lock you into that shape forever. So if you do things to change your shape in the future, if you get pregnant or if you put on weight or lose weight, then your body can change. So pregnancy can make your breasts bigger. They might stay bigger. Sometimes they get smaller again. Sometimes they get smaller than they were pre-op. Sometimes they droop. All sorts of things can happen with pregnancy. I don't want to alarm you, but things can happen. They may just go back to normal, so you may be fine, but things can happen with pregnancy. So that's something to be aware of. You've already had your surgery, so there's not a lot you can do about it. So I wouldn't worry about it, but it's just something to say that might happen in the future, but I'm sure it won't. I'm sure you'll be fine, and everything will be as it was before. So congratulations and good luck with everything. And let me know if you have any other questions or concerns. We've got Anetta, who is saying, how long do I have to wait after having a baby to have implants? So again, that's sort of taking it from a different angle. So you've had a baby. The shape of your breasts will change depending on how long you breastfeed. When you breastfeed, obviously the milk comes in, the breasts get bigger, and then when you stop breastfeeding, the breast gets smaller again, and sometimes that can stretch the skin, and it needs time for that skin to recoil, which may not recoil fully, but will recoil to an extent. So the breast will change in time after having a baby. The minimum, I say, everyone's different, which just shows that there's no science or nothing written in, well, it's sort of scientific, nothing written in stone about it, is 6 months. I'd say minimum 6 months. So before having breast surgery, whether it be breast implants or whatever, after having a baby. Having said that, there are issues of you have a 6-month-old, obviously at home, and so I find, from a practical reasons, a year is usually best. The child's a little bit older, being able to walk. You could argue the child's heavier, but they might be able to walk maybe a little bit easier to manage, because you've got to be a bit careful with regards to lifting and things after surgery, because it's going to be a bit swollen, a little bit sore the first few weeks. So I'd say ideally a year, minimum 6 months. Maybe a compromise is come to the clinic at 6 months and talk about it, and then plan it, a year or a few months afterwards. But that's my advice on that one. I don't know if I spoke about Russell last time with the big sleeve tattoo. I've got a feeling I did, and it was too big. So yeah, the sleeve tattoo is too big. It was a big shoulder one. There you go. So yeah, sorry about that, Russell. So Rebecca's just put, I've got capsular contracture after pregnancy. Yeah, I think there is. Yeah, whether that was a pregnancy, but yeah, that looking to have mine redone. Yeah, so with an uplift. Well, that's the thing about the pregnancy, that it can stretch the skin. So can stretch the skin, and so you sometimes do need an uplift. So that's something that can happen with time and nature and the beauty of having children. But who'd be without them? So Liz says that she's got a tattoo on the small of her back, the size of a normal sized golf ball. And it's basically what I've actually seen. You sent a picture. Thanks for that, Liz. Pictures are brilliant. If anyone's got any questions, particularly about tattoos and things, sending photos is great. So email them to info@staianoplasticsurgery.co.uk, and I'll have a look at them and give you an opinion. But yeah, Liz, you've got a tattoo. That tattoo looks like it could be removed, but it's not a great place for a scar. It's not a great place for healing, because it's sort of at the base of your spine, and so that's something to be aware of. But yes, it could be removed by surgery. I think it would need a couple of goes. It might need a serial excision, but I haven't actually seen you, so you're going to just see yourself by just pinching the skin to see whether it will all come out in one go. I think it's a little bit too big to have one go, so it might need a couple of goes. And Deborah, your BMI is 40 and you'd like to have a tummy tuck. That is not a good idea when your BMI is 40. So I think it'd be better if you could lose weight first. And I know you're saying you're comfortable with your weight. The problem is a tummy tuck is quite a big operation, it's quite a big scar, big risk of complications, and that risk is higher when your weight is higher. And so you would be better losing weight. I think 40 is a little bit too high. 30 is my good weight, if you like, for tummy tuck. But I know that's probably not really achievable for you at 40, because 10 BMI points is quite a lot. But I think 40 is a little bit too high. I think your risk of complications is quite high for a cosmetic operation. I think you risk having worse things happen than the surgery is going to help. Now, if I don't know much about your history, because I haven't actually seen you in the clinic. So if you've lost a lot of weight and you've come from a much higher, and you know way you're going to get lower, then sometimes I do sometimes do surgery on people who've got BMIs higher than 30, but I think 40 is pushing it a bit. I would advise you lose weight for two reasons. One, you get less complications, but also you're going to get a better result, because it's not really a weight loss procedure, tummy tuck. A lot of people think it's a weight loss procedure. It's not. It's not for people who are overweight. It's for people who've lost weight. It's for people, once they've lost weight, the skin is left and your skin doesn't recoil. Same with the breast lift. It's the same principle. The skin is left, so you have to remove the skin. You do remove fat as well, but it's mainly a body contouring operation, not a weight loss operation. But there are surgeries that can be done to help you lose weight, like bariatric surgery. There are different sort of surgeons who do that, gastric bands and things like that. Talk to your GP. There are general surgeons who do that, who specialise in bariatric surgery, gastric bands and bypasses and what have you. But it's difficult. If you don't want to lose weight, then that's probably not, you don't want to lose weight. So, yeah, sorry, my advice is to lose weight first. That's me. I'm going to go somewhere, so I've got to shoot, got to run, got to skedaddle. So I hope that's been helpful. And I don't know if any of the people who've asked these have been there. Rebecca's there anyway, and I hope, yeah, you've supported the capsular contracture and pregnancy thing, but not that that's any proof, but it's, you know. And so I'm going to sign off now, and I'm going to say have a nice evening, everyone. And I hope is this photo a bit asymmetrical now? I notice it. Yeah. Anyway, signing off. Lovely to see you, and I'll see you. Do this again next week. Any questions, email, and I'll make a list, and we will go over them again. Monday, Tuesday, probably Monday. I think I should have looked at my diary before I did this. Yeah, Monday the same sort of time, or Tuesday. I'll put it on Facebook and things. And good. Thanks for coming, and I'm signing off. Adios.